In this vlog, I will tell you about the prevalence of ADHD across adulthood. Is it stable or does it change? In childhood, ADHD has an estimated prevalence of 5 to 7%. It is well known from studies that follow children and adolescents across multiple time points that inattention, and in particular hyperactivity impulsivity symptoms, decrease over time for a subset of children with ADHD. Accordingly, prevalence estimates in adulthood are lower at 3 to 5%. In our research, we questioned whether the prevalence of ADHD continues to decrease across adulthood. That very few older age persons with ADHD are diagnosed and treated in clinical practice highlights that it is important to know if ADHD symptoms decline in old age or if ADHD is under-recognized in old age. To answer this question, we would ideally follow adults with ADHD across multiple time points, as has been done with children and adolescents. Unfortunately, these kinds of studies have not been performed yet. Luckily, several studies did examine adult ADHD at a single point in time, and a recent research paper combined the findings of these mostly small studies to estimate the prevalence of ADHD across adulthood. The paper included two ADHD definitions: symptomatic ADHD, which was defined by the presence of ADHD symptoms in adulthood, and persistent ADHD, which was likewise defined, but with the additional requirement of a confirmed age of onset of symptoms in childhood. It was estimated that the global prevalence of symptomatic adult ADHD is 6.8%, and that the global prevalence of persistent adult ADHD is 2.6%. Importantly, the paper also showed that the prevalence of both symptomatic and persistent adult ADHD decreased across adulthood, and that this decreasing prevalence was more pronounced for persistent ADHD than for symptomatic ADHD. While the research paper did important work by combining the findings of many different studies on adult ADHD, combining can also lead to wrong conclusions. Studies differ in many ways. For example, participants from different countries with slightly different views on ADHD are diagnosed in different ways and differ by age. By combining different studies, we cannot be completely sure that the lower prevalence of ADHD in studies with older participants compared to studies with younger participants is truly an age pattern. It can also be a consequence of the many other differences that exist between studies. Recently, we were able to examine the prevalence of ADHD across adulthood in one big study with a single group of participants and one diagnostic tool. We collected information on ADHD for over 35,000 adults aged between 18 and 91 years. The results of our study are strikingly similar to those reported by the research paper that combined the findings of several other studies. We found that the prevalence of both symptomatic and persistent ADHD decreased across adulthood, with an overall prevalence of 8.1% for symptomatic ADHD and 3.4% for persistent ADHD, with the latter most strongly reflecting a clinical adult ADHD diagnosis. So to come back to the question, we are confident that symptoms of ADHD decrease somewhat over the adult lifespan. Yet, despite this decreasing prevalence, ADHD is severely under-recognized and undertreated in middle adulthood and old age. The lower prevalence in old age, identified in a previous and our own study, is much higher than the prevalence of referred older age patients diagnosed with ADHD, which is in turn higher than the prevalence of those treated.